So good evening, everyone. Welcome to Manjula's Nurses Learning Academy. Dr. Manjula here. So this is the third mock test which we are discussing, and it includes questions from education, administration, fundamentals of nursing, which we have covered in the last 1 week. The belief of a professional nurse that individual is a social being with special needs relates to which of these? Nursing education, philosophy of nursing, objectives of nursing, standard of nursing. Type the answer in the chat box. So did you understand the question? The belief of a professional nurse that individual is a social being with some special needs. So that kind of a belief is addressed in nursing education or the philosophy of nursing or the objectives of nursing, or is it called as the standard of nursing? Are you able to answer? So this is actually comes under the philosophy of nursing. Next question. The word nursing was defined by ICN in the year 1977, 1972, 1973, 1978. Yes, what is the answer here? 1973, ICN. You have 3 letters here and 3 here. So you can remember like that, 1973. Birth year of Aishwarya Rai. Like that also you can remember, 1973. Next question, paradigm can be best described as. So when you talk about nursing theory, this is a word which we commonly use, paradigm. So it can be described as experiential knowledge, a way of looking at the world, a deductive thought process, or middle range theory. So what does it mean, paradigm? What is the answer? It is a way of looking at the world. Okay, paradigm is a way of looking at the world. So I just would like to give a brief intro about paradigm, because this is something which is commonly repeatedly seen in some of the nursing officer questions. Paradigm is conceptual model or a diagram. It is a pattern that may serve as a model or example or way of looking at the world. Simple. Paradigm means how you see the world, how you look at the world. And when you talk about paradigms in nursing, there are 4 paradigms. What are they? Person, health, environment, and nursing. So every single nursing theory addresses these 4 concepts. They define these 4 paradigms in their own different ways. Who a person is, what is health according to that theorist, what is environment according to them, and what is nursing. So each theorist define this in very, very different manners. So the among these all 4 paradigms, the most important is the person or the patient. Right? Next question. The following are the core principles of Dorothy Johnson's behavioral system model except. So theories are very important. Here we are asking about Dorothy Johnson's behavioral system model. So which of the following, which is not there? What is the answer? You can type it out in the chat box. Pan-dimensionality. Okay, so the questions that we are discussing today are picked up from the past 15 years questions, right? This has been asked. So pan-dimensionality. All the other three things are there except pan-dimensionality. So just a bit about Dorothy Johnson's behavioral system model. So there are 5 core principles which she tells. One is wholeness and order, then stabilization, reorganization, hierarchic interaction, and dialectical contradiction. So these are the concepts that she is describing. Next one, the essential component of nursing profession are care, cure, coordination, empathy. Which is the one? Essential component of nursing profession. What is it? Yes, it is care, cure, and coordination. Some may misunderstand it as empathy. No, it is care, cure, and coordination. Next question. An intern orders intravenous morphine for a case of head injury. Okay, so knowing that morphine may be harmful in this case, that is head injury. Okay, head injury, you know that it is harmful. The nurse does not administer the injection, but what does she do? She asks for confirmation from the doctor. So what principle of bioethics is she following here? What is it? So a head injury patient, there is already a written instruction to administer morphine, but as a nurse, you are counter checking it with the doctor. Are you sure we are going to give morphine for this patient? You know, in head injury, what happens if you give morphine? It will cause respiratory depression. So intravenous morphine. So what is the principle that she has followed? She has followed the principle of non-maleficence. That means doing no harm to the patient. Next question. According to Hilgard Peplow, the theorist, one of the sub-roles of a nurse is priest, academician, builder, mother, surrogate. This is a very direct question. It is mother, surrogate. So who was Hilgard Peplow? She was a nurse theorist, and which theory did she develop? Interpersonal relations theory. Okay, what was the year? 1952, and she is also known as the mother of psychiatric nursing. You know this. There can be so many questions asked from this. So I would suggest that you please read. Here I am talking only about Hilgard Peplow because the question is related to that. I would suggest that you know a little bit more about the more common theorists. So she is known as the mother of psychiatric nursing. According to her, what is the goal of nursing? That is to develop interaction between the nurse and the patient or the client. So it is about interpersonal relationship, right? So she is talking more about the interaction between the nurse and the patient. Also, she tells that there are 6 main roles for the nurse. What are they? According to her, they begin as a stranger, a teacher, resource person, counselor, surrogate, and leadership roles. So these 6 are the roles which the nurse has towards the patient. Next question, the man living health theory is also called as Parsis human becoming theory, Rogers model of science of unitary beings, Pender's health promotion model, Roy's adaptation model. So which this theory is also called as, what is it? Parsis human becoming theory. Okay. Next question. Individualized, comprehensive, and consistent care provided by one nurse for the total period of care, that is 24/7 throughout round the clock, is known as what? This is also, all these aspects you should learn it, because this core area has been repeatedly asked in many question papers. Okay, so this is a very important area. So what is a case method? What is a functional nursing? What is team nursing? What is primary nursing? You should be knowing. So in this question, what is it? What is the answer? Can you type it out in the chat box? When one nurse provides round the clock care, what is it called as? It is primary nursing. Next one, the type of hospital patient care assignment which requires giving complete nursing care to a specific number and category of patients during the scheduled duty hours. Functional assignment, individual case assignment, team nursing, organizational nursing. What is the right answer? Again, this is about patient care assignment where complete nursing care to certain particular group of patients during your scheduled duty hours. That is called as individual case assignment. So certain cases are being assigned to you and you will take care of them during that particular scheduled duty hours or particular shift. Next question. This is little, when you have questions like this is a little bit tricky. So you should be very careful. Ethical principles in nursing profession are beneficence, non-maleficence, fidelity, veracity. Is it only A, B, and C, or is it B, C, and D, or is it A, C, and D, or is it A, B, C, D? Yes, right? Yeah. So it is all of these are the ethical principles. Very good. Next question, when assessing rectal temperature, the nurse would use extreme care when inserting the thermometer to prevent which of the following? So you are taking rectal thermometer. So you should be cautious to prevent which of the following: increase in heart rate, decrease in heart rate, decrease in blood pressure, increase in respiration. What is the answer here? Yes, right. So it is a decrease in heart rate. Why is it so? Because when you are putting the rectal thermometer, you are actually stimulating the vagal nerve, and that will cause bradycardia. So the vagal nerve is stimulated, and which can cause bradycardia. Okay. A question to calculate 101.2 degree Fahrenheit to Celsius. So here itself the formula is given, and the answer is 38.4. You know the formula. This formula, please learn it by heart, converting Fahrenheit to Celsius and Celsius to Fahrenheit. You may have questions. So C is equal to F minus 32 divided into 5 by 9. So the answer is 38.4. Next question. A nurse is preparing to care a patient with potassium deficit. That means hypokalemia. So the nurse reviews the patient's record and determines that he is at risk of developing potassium deficit. Why? Because the client is on potassium sparing diuretics, is on nasogastric suction, has history of renal disease, has history of Addison's disease. So in which of these conditions, or why is it that the patient is having potassium deficit? Is it because he is on potassium sparing diuretic, on nasogastric suctioning, has renal disease, has a history of Addison's disease? What is the answer? Type the answer in the chat box. The answer is nasogastric suction. Exactly. Why? Because when you are suctioning, you are removing along with the gastric juices, you are removing the potassium as well. Or even patients who have chronic vomiting, diarrhea, they all lose potassium and they go into potassium deficit. All the other conditions, A, C, and D, it is hyperkalemia that is happening in these situations, right? Next question. The fever in which temperature remains above normal throughout the day and fluctuate more than 2 degree Fahrenheit is known as what kind of fever? So this is also another important question which has been repeated in several question papers. They can ask you, any of this can be asked. Okay, each of these choices are one MCQs. So in this, what kind of fever is this? The fever, the temperature remains above normal throughout the day and fluctuates more than 2 degree Fahrenheit is known as intermittent fever. Okay, just a pattern of fever that varies more than 2 degrees centigrade above normal over a 24-hour period, but does not return to normal. So there is a variation of 2 degrees centigrade, but it doesn't come back to normalcy. There is fever continuously, but there is a variation up and down 2 degree centigrade that is there, and that is called as remittent fever, right? Next one, a pattern of fever that rises from normal to subnormal to high, normal or subnormal to high and back at regular intervals, especially high in the evening and low in the morning, is called as intermittent fever or quotidian fever. So you have, high in the evening and then low in the morning. This intermittent fever. Next is recurrent fever. Recurrent fever is fever that will return to normal for at least a day and then again it goes back. So that is called as relapsing or recurrent fever. So here, the body temperature touches normal and then again go back. But here you see it doesn't reach to normal. Then fourth one, the body temperature remains consistently elevated above 38 degrees centigrade and fluctuates less than 2 degrees centigrade is called as constant fever. Okay, so these are the different types of fevers. Next one, symbols used for drug administration before sleeping at bedtime. So when a medicine has to be given at bedtime, what short form do you use in this? Yes, very good. HS, yes. So this is very important. Okay, question papers have asked this in very different ways. So please learn this. HS means what? Hora somni, that means at bedtime. Then HN is hac nocte, which means tonight, today, this night you have to administer. SOS means if necessary in emergency. What is that? Psi opus sit. And OM is omni mane, that means every morning. ON means every night, omni notte, each night. And AC means antisebum is before meals, and PC is post-sebum after meals. Next one, what is the color of peripheral venous cannula of 16 gauge? So 16 gauge, again, this is also a commonly asked question. They'll give you the color and ask the gauge, or they'll give you the gauge and ask the color. Yes, exactly. So the answer is gray. People are typing in the chat box quickly because you are very, very familiar and aware when you are working in the clinical side, right? So all the color codes of cannula, orange is 14 gauge, gray is 16, green is 18, pink is 20, blue is 22, yellow is 24, and purple is 26. Next question, a patient had an extensive and prolonged surgery. Which electrolyte should be monitored closely? Any guesses? Potassium, sodium, calcium, chloride. Which one has to be monitored? See here, what is the keyword? It is extensive and prolonged surgery. So in that case, what electrolyte imbalance can you expect? Any guesses? B. Any other guesses? A, B. Fine. So the answer is potassium. Okay. Why? Because there are so many reasons. Especially, you should remember one thing. Whenever your tissues are injured, okay, the cells, the tissues are injured, what happens? Where is the potassium seen in your body? It is seen inside your cell. Okay, the situations where your cells are injured or your tissues are injured, this potassium will be released from the cells to the plasma, or it comes out of the cell, causing hyperkalemia, right? So it jumps from the injured cells into the blood, causing hyperkalemia. And what are the situations where you can injure or you can have extensive damage of the tissues? It can be surgery, extensive surgery. Then it can be burns. It can be a soft tissue injury after a trauma, a road traffic accident, where so much of soft tissues has been damaged. Okay, so some of any situation where your cells are damaged, it will cause hyperkalemia. There are so many other situations also causing hyperkalemia, but one general rule is whenever the cells are injured, it will result in hyperkalemia. Okay, so in this case, hyperkalemia that is due to prolonged and extensive surgery. What are the reasons? Soft tissue injury. That's what I told. No, the more tissues are being injured or cut, then it will release the potassium. Cellular shift, that is metabolic acidosis. If it occurs, that time also the potassium moves out of the cell. Then renal impairment also will cause reduced excretion of the potassium through the urine. Then loaded blood transfusion. Another thing, if you give more blood transfusion, of course, there will be some lysis of the RBCs, and because of that, you may get hyperkalemia. Then local anesthetics like succinylcholine also will induce potassium release. So you can remember, this is a mnemonic, okay? This is a mnemonic. Surgery can rise potassium levels. How? How? Because of the soft tissue injury. S here stands for soft tissue injury. C stands for cellular shift, means metabolic acidosis. Okay, cellular shift. That means the potassium shifts out of the cells due to the metabolic acidosis. Then R stands for renal impairment. Why the renal impairment happens? Because of the decreased blood circulation to the kidneys. Then blood K stands for potassium loaded blood transfusion. More blood transfusion if you give, there is a chance of hyperkalemia. L stands for local anesthetic. Here succinylcholine also will induce potassium release. So these are the reasons for hyperkalemia in patients who are undergoing surgery, extensive surgery, right? Next question. Which action by the nurse in charge is essential when cleaning the area around the Jackson-Pratt wound drain? Cleaning from the center towards the periphery in a circular motion. Cleaning from the periphery towards the center in a circular motion. Cleaning briskly around the site from left to right, and cleaning briskly from around the site from right to left. Very easy question. Please type out the answer in the chat box. What is it? See, there is a wound drain. How you have to clean around the wound drain. Yes, excellent. Very good. It should be from the center to the periphery. Why? Because any wound, the center is you want to keep from the any wound. We have to keep the area around the drain or the center area should be very clean. So you have to wipe it from the center to the periphery. So the drain site is so you are considering it as the most contaminated and you clean it from the center to the periphery. How? Next question. How bandages should be wrapped? Proximal to distal, distal, proximal, lateral to medial, medial to lateral. Very easy. What is this? What is the answer? It should be wrapped from proximal to distal, right? So if you're wrapping a bandage from this in this hand from here to here, you will start from here. This is the proximal to the distal. So from down to up you do. So what are the principles of bandaging? Apply bandage from distal to proximal. Wrap the bandages firmly but not too tightly. Overlap turns by 1/2 to 2/3 width of the bandage roll. Assess the distal circulation when the bandage application is complete and at least twice during the 8-hour period. So some principles of bandaging. Next one, trace minerals are called when RDA per day is less than 100 milligram, 200, 300, 400. So how much is the RDA that you require for a trace mineral? That is the question. So for trace minerals, your requirement is 100 milligram. So when you talk about minerals, this is a question from nutrition. When you talk about the minerals, you have macro minerals, micro minerals, and ultra trace elements. Macro are required in or they are the major elements, and the daily requirement is more than 100 milligram. If you look at the micro minerals, the daily requirement is less than 100 milligrams. So what are some of the macro elements? Macro minerals are calcium, magnesium, and phosphorus, then sodium, potassium chloride, and sulfur. Micro minerals are iron, iodine, copper, cobalt, manganese, molybdenum, selenium, zinc, and fluoride. And ultra trace elements, their requirement is less than 1 milligram per day. Next, talking about pasteurization. It's a method of heating milk to 63 degrees centigrade for 30 minutes followed by sudden cooling. That is called as, so in pasteurization, the method of heating milk to 63 degree for 30 minutes and then you suddenly cool it, and that is known as what? This is a process of pasteurizing the milk. This step is called as holding. Okay. Next one, the power which is very good, Adira. The power which is exercised because of appointment to a higher position. Now we are coming to management questions. So when you are in a higher position, what power do you exercise? You know, the chief minister has certain power. So when he is in that position, what the power that he exercises is known as exclusive power, expert power, reward power, referent power. It is called as exclusive power. Next question, hospital admission rate is given by which of this formula? Important this is, okay? Especially you are writing a nursing officer examination. So these things you should be knowing. Hospital administration rate, how do you calculate it? Total admission during the year divided by mid-year population into 1000. Total admissions during the year divided by mid-year population into 100. Total admission during the year divided by mid-year population into 10,000. Or total admission during the year divided by mid-year population into 10. Which is the formula? The first one, okay? So your total admissions during the year divided by mid-year population into 1000 is hospital admission rate. Similarly, the next question is asking about bed occupancy rate. How do you calculate the bed occupancy rate? Average daily census divided by average length of stay into 100. Or is it average daily census divided by bed complement into 100? Or is it average daily census divided by bed turnover into 100? Or average daily census divided by bed turnover interval into 100? Any guesses? No? Okay, the second one is the answer. So just remember the formula. Bed occupancy rate is calculated by average daily census divided by bed complement into 100. Next question is about budgeting. What are the key activities in budgeting? Acquisition, allocation, controlling, affiliation. Is it A, B, and C, B, C, and D, or A, C, and D, or A, B, C, D? Which is the answer? Any guesses? Actually, it is A, B, and C. Okay. The answer is A, B, and C. This one. Choice A. So the answer is acquisition, allocation, controlling. Affiliation is not part of budgeting. Okay. The answer is A, B, and C. Next one, a written order for supplies and equipment or for their repair. You should be knowing this. Those who are working in the hospitals will be knowing it. Is it called as inventory, intent, requisition, or quotation? You are giving a writing order for the repair of the equipment. That is called as no. It is requisition. Inventory means what? No, it is inventory means you are just taking a census of how many things are already there, how many has been, whether the numbers match, right? But requisition means you are writing, you are writing, you are giving in return these many things are damaged and we want it to be repaired. Okay, that is called as requisition. Intent is what? Intent means you are procuring. What are the requirements for your unit? You are procuring it from the material store. And quotation is what? When you are purchasing something, quotation is not under the purview of a staff nurse or nurses. It is done by the hospital management, purchase department. They will send whatever items, the list of the items they want to purchase, they'll send it to the manufacturer and they will send the amount for each of the item, the unit price and the total price and the total budget. That is called as quotation. So the hospitals will take quotation for the same thing from different suppliers and they will compare whose quality is good, who is giving it a better price, and then they will accept it. That is called as quotation. Okay, fine. I have already explained it. Next, this is also very important area. Please focus and learn this also. Okay. Which of the following inventory control method is based on the criteria of rate of consumption of the items? ABC analysis, Veda analysis, HML analysis, FSN analysis. So ABC analysis means it is like this always, better control. Veda analysis means vital, essential, desirable. HML analysis means high, medium, and low. FSN analysis means fast, slow moving, and non-moving. So the type of classification of inventory control that where you are looking at the rate of consumption of the items. So depending upon the rate of consumption of items, you are looking at the inventory. What is that? D. Any other answers? Any other answer? Excellent. So D is the answer. Next question. Components of in-service education are all of the following except. So in-service education, what are the components? Orientation, skill training program, continuous nursing education program, health program, leadership training program. What is the answer? A, B, C, or D? Which is the answer? So in-service education program contains all of this except the answer is health program. So here you, for in-service education, you give orientation programs of a new recruit, continuous nursing education programs to update yourself, and leadership training program for head nurses or senior level nurses. All these are part of in-service education except the health program. Right here, same. Next one, TNI was established in which year? 1808. Sorry, 1908, 1912, 1960, 1920. Excellent. 1908. Next question. Components of in-service education are all of the following except. So in-service education, what are the components? Orientation, skill training program, continuous nursing education program, health program, leadership training program. What is the answer? A, B, C, or D? Which is the answer? So in-service education program contains all of this except the answer is health program. So here you, for in-service education, you give orientation programs of a new recruit, continuous nursing education programs to update yourself, and leadership training program for head nurses or senior level nurses. All these are part of in-service education except the health program. Right here, same. Next one, TNI was established in which year? 1808. Sorry, 1908, 1912, 1960, 1920. Excellent. 1908. Okay, so again, TNA is also known as, previously, initially it was known as Association of Nursing Superints. Okay, and it was founded in 1905 at Lucknow, and at the annual conference in Mumbai in 1908, they decided to establish Trained Nurses Association and inaugurated it in the year 1909. In 1922, Association of Nursing Superints and the TNA was merged together, and then it was called as TNAI with its headquarters in New Delhi. So who was the first president of TNA? It was Miss Allen Martin, and the first secretary was Miss Byrne. Then, okay, there have been many questions. Each of these sentences is a question which has been previously asked, okay? So, Nursing Journal of India is the official publication of TNAI, and it's published monthly. TNAI became a member of the Commonwealth Nurses Federation in 1974. So, that year also, please remember. TNAI became the member of Commonwealth Nurses Federation in 1974. Next question, which among the following agencies of teacher education program provides fellowship for teachers and project work for universities? University Department of Education, University Grants Commission, National Council for Teacher Education, State Board of Teacher Education. This question was asked in one of the central government examination for nursing tutor post. Okay, so what is the question? Which of these will give scholarships or fellowships for teachers to conduct research? Which is it? Easy. UGC, University Grants Commission, they provide grants for conducting projects by the teachers. Next one, the blueprint for educational program is called as philosophy, lesson plan, curriculum, educational objectives. This is also important. So a blueprint for an educational program. To run a nursing be a bachelor's in nursing program, you should have some blueprint. And what is that blueprint called as? It is called as curriculum. Curriculum is an important topic. So what is curriculum? Curriculum is the sum total of all the selected experiences, all the experience that you get in the school, nursing school or college for the nursing students, so that the objective is achieved. So you have an objective for nursing education program, right? And then the college would have picked and selected so many learning experiences so that you achieve the objectives of the program. Program means nursing bachelor in nursing course. So that is called as curriculum. So this is the standard definition of curriculum. Each word is important. What are the key words? Sum total. It is not just studies. It includes your assignments. It includes your field visits. It includes the camps that you conduct, everything. So it is a sum total of selected experiences, selected learning experiences. Like, you will be taken for observation visit to Sri Chitra Regional Cancer Center. You may have experiences in NIMHANS for psychiatric nursing. Like that, it's a sum total of everything that has been planned by your college or your accreditation body. Like in India, it is Indian Nursing Council. For a defined group of students, that means if you are a first year bachelor's in nursing, then you have certain activities or certain experiences set for you. If you are fourth year bachelor's, then you have certain other set of experiences. So for a particular defined group of students, the sum total of the experience that has been selected by the college, so that what is the purpose of it? You achieve the objectives of the nursing program. So objective of bachelor's of nursing. So what is that? Those are listed down objectives. Accordingly, what all experiences has been selected. That is called as curriculum. So the keywords are sum total, selected learning experience, defined group of students. And this is another question which was asked. Objective of the purpose of curriculum is to fulfill the objectives of a particular educational program, right? So curriculum, of course, I already mentioned that the definition of curriculum given by Cunningham. This was another question which was asked in the previous question paper. So curriculum is, he has defined curriculum as a tool in the hands of artist. See how that imagination is running, to mold his material according to his ideals in his studio. So he has defined curriculum in a very artistic manner, and Cunningham has defined it like that. This was a question. Now coming to different types of curriculum. So the null curriculum was asked, then hidden curriculum was asked in previous question papers. So I've just summarized all the different types of curriculum which has been asked in the previous questions for you to just go through. So null curriculum. Null means what? Null means nothing, right? Nothing. So null curriculum means the topics which are intentionally or unintentionally excluded from the formal education system. So certain experiences which or knowledge or topics which are like literally excluded from the formal education, Okay, that is called null curriculum. Hidden curriculum means what? Hidden curriculum is actually about the values, the belief system, the norms, all of that. It is students learn through the educational environment rather than the formal instruction. See, for example, when you learn about nursing, there is more of caring, selfless devotion, or more of empathy. So many such things, so many values comes. And then as soon as you land up in your first year BSc nursing program, your teachers will tell you to put up your hair, cut short your nails, no nail polish, that there's so many things. Ultimately what happens is those values get ingrained in you. So you might be as a young student, a new recruit to a nursing college, you might think, why such restriction? If I don't put up the hair, am I not going to give nursing care? I am giving nursing care with my hands. So what it has got to do with putting up my hair? Or what it has got to do with me not wearing lipstick? Or what it has got to do with me having nail color, nail paint? So such things may go through your mind, but so those things like nail polish should not be used, or your drops you should only wear small tiny studs, like that. Those things, where it is written, where in the curriculum it is written. So these are all unwritten rules which comes along with the nursing course as you learn the nursing course. Those things are part of hidden curriculum. Okay, so those things are called as hidden curriculum. Legitimate curriculum means what? INC has made certain curriculum, certain topics that you have to learn in the first year, what all practical items you have to learn, what all theory courses you have to learn, all those comes which are formally recognized, and that comes under legitimate curriculum. And illegitimate curriculum means you teach certain things, but they are all not recognized, or they are all unauthorized content that does not constitute the formal educational framework. INC has never told anything like that, but still sometimes you may have those things in your curriculum. So this is a mnemonic. No head looks intelligent. So different types of curriculum. N stands for null curriculum, where your topics are excluded or knowledge excluded. Null, it is not there. H stands for head. This H stands for hidden curriculum. Then L stands for legitimate. I stands for illegitimate curriculum. Next question, the approach of nursing process of giving nursing care can be regarded as. See, the question is, in nursing care, we always talk about nursing process, and it can be regarded as core curriculum, societal curriculum, instructional curriculum, institutional curriculum. What curriculum does it belong to? The answer is, again, as young nurses and nursing students, first year itself, you will start writing the care plan. Like you start learning about nursing process, and then you go to the clinics and try hard to practice, get accustomed to the art of writing a nursing care plan using nursing process. But many times we have wondered why we need to study all this, because we have always felt it very, very difficult. And each teacher will tell one thing, and we are not able to satisfy any of the teachers. So even to this day, when I teach students in Saudi Arabia, the same question repeats. They also ask me, why this nursing process, doctor? So I can only tell you that it is part and parcel of nursing profession, because nursing process is the most essential core curriculum that you need. So the approach of nursing process comes under core curriculum. Core curriculum means essential things. See, whatever theory aspects that I have given to you to learn in our video classes, it is all core curriculum. Okay, there is nothing nonsense in that. It is all core curriculum. So there are so many essential aspects that which you need to really, really know, which falls under core curriculum. So the set of course that is considered as basic and essential for future course or a study which are utilized to solve the problem of common patients is called as core curriculum. So nursing process, you require it in the first year, second year, third year, fourth year, right? Throughout your life, as long as you decide to be a nurse. Every time you keep using it and practicing it. So that is called as core curriculum. Next question, dynamic approach to teaching means teaching should be forceful and effective. Teachers should be energetic and dynamic. The topics of teaching should not be static but dynamic. The students should be required to learn through activities. So what do you mean by dynamic approach to teaching? Dynamic means what? Moving, or there is so much of activity happening. It is not static. It is not staying in one position. So what do you mean by dynamic approach to teaching? Type out your answers in the chat box. Any idea? D is the answer. So when your student should be learning through activities. That is called as dynamic. Unlike the teacher talking, explaining, and the student passively sitting and listening. No, that is not dynamic approach. In dynamic approach, we want the students to work. Right? When you were students, your teachers would have given you assignments, case study, case presentation. They want you to go to the hospital, take a case, analyze it, and then write a plan for their care. So all those, you are made to do all those activities. Why? Because your curriculum is a dynamic one. Next one, while planning for a class, the foremost task of the teacher should be decide the content, set the learning objectives, decide the method of teaching, select the appropriate educational media. So when, as a teacher, what is your most important task when you're planning a class? What is it? Basically, the first thing that you should do, or what is the most important, is you should set the objectives. What do you want to teach? See, when I am taking class to you, my objective is what? My objective is to give you the maximum number of questions which are qualitative or which are really, really worth solving, and also the questions which are being asked in the past couple of years. So we know that those are the core areas from which other questions also can be developed. So that was my objective when I planned this mock question paper discussion. So objective is the first thing. You should know or set the learning objectives. Accordingly, you will select your teaching learning activities, experiences, etc., etc. Next one, a type of attitude assessment tool in which several declarative items are given to express the viewpoint of a topic. So the key word here is viewpoint. Okay, somebody is expressing their view, and how is that written? It is written as a statement. And also this is, we are talking about attitude assessment tool. So which of the following is that? Cue sorts, observation checklist, Likert scale, scaleogram. Observation checklist, you can eliminate it because you know what it is. Checklist, most of us nurses are very, very familiar with checklist, right? You tick, tick, tick. Like every day use, we follow this, making use of the checklist to buy items for your cooking in the kitchen. So you will have, lady's finger, coriander leaf, curry leaf, onion, tomatoes. You will have a list, and as soon as you buy it, you will check it out or delete it, right? That is called as checklist. So observation checklist, you observe certain activities and then put a tick. So anyways, that is not an attitude assessment. It is only a practice. You're observing a practice and then doing the assessment. So that is, you can eliminate that. Then we have three other options. In this, which of the following is a attitude assessment tool where you give declarative items to express a viewpoint? Yes? May I know the answer, please? It's Likert scale. So what is Q sort? Q sort means you have so many statements based on, now suppose somebody is asking to me to give my opinion on what do I think about nurses' attitude towards or dealing, nurses' attitude towards dealing with HIV positive patients. So my personal preferences or my choices, I will write it in a statement and then I will rank it. Okay, which is the first, second, third, like that. That is called Q sorts. You will have opinions of different people. You will compile it in different orders, and then you will come to a conclusion. So this is actually a method of collecting research data also. Then observation checklist I have already described. Likert scale means it is a rating scale from 1 to 10, usually 1 to 5, where you will talk about the opinion and the attitudes. For example, I will give a statement like, are you, I am able to sleep peacefully every night. That is the statement. Then you will have in the Likert scale different ratings like rarely, sometimes, often. So like the 3 or 5, I can make it as 5 also. So I can say like, if I'm not able to sleep properly, most of the days I'm not able to, then I will write rarely. Or every day I'm able to sleep properly, then I'll say every time. So the ranking will be like 1, 2, 3. So that is called as Likert scale. You have an opinion in a statement written, and then you will have different scales of measurement. Scaleogram is how consistently individuals respond to a set of hierarchical items about opinion about nurses giving care to HIV positive patients. So how consistently means now also you respond to that in a particular hierarchical way. Again, after 2 weeks also you respond the same way to those items, then you will put it as scaleogram. Okay, so these are some of the methods of assessing the attitude, or even data collection in research also we use this. Next one, the approach to counseling in which the therapeutic process is directed along lines considered relevant by the counselor is named as. Okay, so this is talking about counseling. So the approach to counseling where the therapeutic process is directed along lines considered relevant by the counselor. So the counselor is telling something to the the client, do this, do that. That is what the question means. Okay, I hope you understood. So the counselor is telling, or the counselor is giving direction to the client in a way that the counselor feels relevant. You have to do like this, or you have to do like that. The counselor himself is telling to the client. What is that called as? Non-directive counseling, directive counseling, vocational, and elective counseling. So in the name itself, it is there. It is called as directive counseling. Means the counselor is giving direction to the client, what to do, what not to do. So there are different types or approaches to counseling. Directive approach means, just now I discussed. Non-directive or permissive approach means it's a patient-centered approach. The counselor will just leave it in the hands. He will tell all the positive, negatives, everything, and just leave it in the hands of the patient to take a call on it. So that is called as a non-directive approach. Sometimes, some patients, they are in such a mental situation that they will not be able to take any decision. They will be so confused. They will be either in anxiety or panic mode. So that time, the decisions counselor may take for the benefit of the patient. But in non-directive counseling, the patient is able to take a decision, and the counselor just leaves it in the hands of the patient, okay, to carry on with the decision. Eclectic counseling approach means the counselor uses both the approaches, directive and non-directive counseling, for the purpose of changing the patient's opinions and attitudes. So a combined method is called as eclectic counseling.